What is really happening with the vaccination program across the length and breadth of India? Here's a comprehensive update.
Gurugram's first drive-in vaccination centre, with lines of cars already crowded outside for a Covishield shot. This a day after the government has doubled the interval between the two doses to 12 to 16 weeks. Though a vaccine shortage is seen as one of the reasons behind this decision, the government calls it purely a scientific one.
जो initial studies करी गई थी इस particular vaccine के बारे में ऑक्सफोर्ड यूनिवर्सिटी ने, उन्होंने 44 हफ्ते तक के बारे में भी बोला कि भाई 44 हफ्ते तक वैक्सीन दी जा सकती है दूसरी डोज.
The advantage of doing drive-in is, of course, A, it takes the pressure away from hospitals, and B, there's automatic social distancing. We are working very closely with the Gurugram authorities to see if we can get more vaccines to conduct this drive in other malls as well.
It's a very good arrangement, excepting for they should display how many doses are left over, because otherwise people have to keep waiting, and for elderly citizens it becomes very difficult.
A government centre where vaccinations are being given here. Karnataka has, of course, stopped the giving of vaccinations to those in the age group 18 to 44 at government centres. Some private centres are still giving the vaccines. The private hospitals who have acquired the vaccines directly are still giving vaccinations to those between the age group 18 to 44 who have registered. But even then, preference is given to those above 45 who need their second dose.
But the vaccine shortage is a reality and hitting the drive across the country.
Government is instructing us to complete the second dose. Once we get enough stock, we will start with the first dose, ma'am.
मैं नहीं चाहूँगा और वक्त लेने के लिए, क्योंकि जब फर्स्ट ले चुका हूँ तो दूसरा तो मेरा ज़रूरी है लेना. जैसे वैक्सीन की शॉर्टेज हो रही है तो सबको मिलना चाहिए, ठीक है, तो इसलिए हो सकता है कि टाइम पीरियड बढ़ा दिए हैं.
Bharat Biotech has now agreed that its vaccine will be manufactured by 3 PSUs. The government also says it will have over 2 billion doses and 8 vaccines in the country by the end of December. Bureau Report, NDTV.
All right, let's make sense of these developments that have taken place. Dr. Manu Chaudhary, consultant infectious disease pediatrician at the Rainbow Children's Hospital, joins us. We also have Dr. K.K. Handa, Chairman ENT Head Neck Surgery from the Medanta Hospital with us. Thank you, doctors, very much for sparing your time this morning. Dr. Handa, if I can begin by asking you, there is a fair bit of confusion in the country at the moment over the vaccine strategy. Now, 2 days ago, we had an update coming in from the government that the Covishield dosing regimen has been increased to 12 to 16 weeks. And the reason for this was the fact that there is data from the UK to suggest that it's more efficacious. We've now seen the UK go back to an 8-week dosing regimen, fearing the rapidly transmissible variant in India. How do we make sense of this?
See, probably the reality is there is a shortage of vaccines, and the 18 to 45 is a very big age group. And suddenly, maybe we have to involve more suppliers, we have to involve more companies. And this gap is increased. There is data to support that. There is nothing wrong with that. But this gap is probably increased so as to buy some time. But we had to have more players who are roped in to supply the vaccine. There is a shortage, especially the private players. Now, government has asked the private players to buy from the manufacturers. The manufacturers are under pressure from the government to supply to the government. So there is no vaccine with the private players.
Right. So you're saying that the strategy decision in India has largely been prompted by a shortage of vaccinations and not so much by efficacy data saying that a 12-week gap actually increases vaccine efficacy?
No, there is data. There is no doubting that data, but there is a shortage also. We can't deny that.
Right. Dr. Chaudhary, what do you make of these developments in terms of, from a viewer's point of view? This is the third time that this dosing interval has been changed, and for the last 2 days we've had experts here on NDTV talk about the fact that we are going by data that's available from the UK, only to wake up to news of the fact that the UK has gone back to 8 weeks for 50 plus because they're concerned about the variant in India.
So there is data which showed that if you increase the gap, the efficacy is better. So when they did the series of trials and different arms, And probably that could be one of the reasons we are now gapping and making sure at least one dose is given, and people who are now delayed with their second dose, they get it, so that we protect patients and public against severe disease, right? So the goal of this vaccination is we decrease the severity of the disease so our healthcare doesn't crumple. But again, as doctor said, we do feel there is shortage of supply as well. But there is a scientific reason behind this gapping.
But, you know, the other question then, Dr. Handa, is the timing. At a time when, you know, we are seeing a dip in the number of cases, we are seeing a dip in the number of deaths, a slight dip in the number of cases and deaths. Our positivity rate is still, you know, just below 20%. It is still at 18%. Is this really the best strategy? Because we've now had experts from the COVID working group also come out and say that India should have perhaps delayed the rollout for 18 and above.
I will feel otherwise. I think we should hasten our vaccination program. If you want to avoid the third wave, you have to be fast with the vaccination. Whatever way we procure it, just increasing the gap or delaying, I don't think will solve the problem.
Right.
I'll give you the example of healthcare workers. We are all working in hospital. Just because we were vaccinated, there are issues, there are mortalities. It is much less.
Right.
Had healthcare workers or frontline workers not been vaccinated, we would have seen them falling like winds.
Right. Dr. Chaudhary, if I can come back to you, you know, since you're also a pediatrician and you're dealing, you know, primarily with children, have you seen a lot more children being impacted, you know, in the second wave of COVID? What is your experience been? How has it been different from the first wave? And given the fact that we still don't have a vaccine for children, do you believe that they continue to be at a high risk?
So compared to first wave, we are seeing higher cases of pediatrics in our hospital. But again, there are two reasons for it. One is that mutant strain, which is very transmissible, right? And we are seeing a lot of community spread and more numbers in the adults. So we will, of course, see higher numbers in pediatrics. Saying that still 90% of these children are being managed at home. We are doing video consultations across our 14 units, almost like 500 a day, and they're doing very well. Only, you know, in the last 2 months, we've had around 150 pediatric cases admitted in the hospital. Only 10 of them required ICU care, and there was no mortality.
So you're saying that
I want to pass on this message.
Please finish your point.
Parents, then please don't panic. Still, children are, you know, mildly affected compared to adults, and they will be, even if we have third wave, we'll probably see the similar data.
Right, but you know, the question is, are more number of children being infected? And is there a difference from what you saw in the first wave?
There is more numbers, right? Because we have higher numbers of adult cases as well. So there's no denying that. And then your second question was, how different it is. So in our first wave, we didn't see that much longer duration of fever, which we are seeing now for pediatric cases. And then we are seeing more GI cases, so where vomiting and loose stool is happening. And we are seeing some newborn cases also being affected. So that is a little bit different compared to the previous wave.
Right. Dr. Handa, you know, a quick comment on the fact that we are also in the process of now, you know, inducting a third COVID vaccine. The first dose of the Russian vaccine, Sputnik, was actually given out yesterday. Are you hopeful that with the third vaccine entering the market, we'll be able to pick up pace?
See, anything which meets the basic standards and qualifies should be taken in. Whether it is Russian, whether it is Indian, I think that debate should be over. The first aim should be to protect as many people as we can. India has 150 crore people. And the third wave can also come if we are not adequately protected in the second wave. So the first priority should be vaccination.
Right.
At the fastest possible pace.
Right. Dr. Chaudhary, clinical trials for phase 2 and phase 3 of Covaxin in the age group of 2 to 18 have also been given the drug controller's nod. How are you looking at these developments, and what would you like, you know, what's your assessment? How long do you think it will take for India to have its first vaccine for kids?
Sure. So it's very reassuring. When they did their study in adults, they had children about 12 years in their data group. So, and there wasn't any side effect that was reported. And I expect in 2 to 12 years also we'll see similar information. And I am speculating probably in couple of months we would have co-vaccine available for younger children as well. In US, Pfizer has already rolled out for 12 years and older, and hopefully similar thing we would see in India soon.
All right. So that's, of course, a lot of hope there pinned on that clinical trial. Phase 2 and Phase 3 has actually been given the nod by the drug controller. Covaxin is trying out its vaccine in the age group of 2 to 18, and if it does in fact go through, it will become India's first vaccine for children. Dr. Handa, I want to also, briefly request you to touch upon some of the different things that one is seeing in the second wave. For instance, cases of black fungus. This has been a huge cause of concern. The Health Ministry has actually now come out and issued guidelines on how to deal with this. This has emerged as a new phenomena as far as the second wave is concerned.
Yes, it is. We are seeing abnormally high cases of mucormycosis, which is the scientific name. Otherwise, it is called fungus.
Yes.
Before COVID time, in 1 month, I would have seen 1 case. I am a ENT surgeon in a tertiary hospital. In the first wave, I was seeing 1 case a day, in a week. Now I am seeing 10 to 12 cases per day. So this is the gravity. Right. And it is a fungus which is there. It is ubiquitous. It is around all of us. But once in a deprived setting, in COVID setting, uncontrolled diabetes, steroid use, prolonged wrong doses, higher doses, and without any supervision. People are on WhatsApp, they are taking steroids. And once patient recovers also, still the immune status is low. And once this fungus catches, this is not a surface fungus. It causes angioinvasion. Right. It invades the vessel. And the distal tissues to the vessels, they get gangrenous, blackened. That is why the name you see by black fungus. And it spreads so fast, it starts in the nose, sinuses, involves the eye, and goes to the brain, the surrounding parts of brain like cavernous sinus and brain. And it is a matter of few days. So unless we learn to recognize fast, which is at a patient when they are being treated in COVID wards, symptoms like nasal bloody discharge, some facial pain, swelling, eye swelling, some change in vision, double vision, headache, immediately a red flag should be raised. Unless we pick them early, we treat them, the consequences are disastrous. And it is not just something which is here and say it is bad. And maybe it is something to do with the type of virus in the second phase. Maybe it is something to do with some humidification, the sterility of the tubing, oxygen tubing, the water which is being used in these oxygen tubing things. But the main uncontrolled diabetes.
Right. So uncontrolled diabetes and wrong or prolonged use of steroids without medical supervision. These are, the two things that one really needs to be watchful of. But, if I can just ask you a quick follow-up question on the issue of black fungus, because I know that this is something that's a huge cause of concern. In fact, we're putting out a map on our screen right now where we are talking about the officially reported deaths and cases of black fungus. At what point during the COVID infection does this occur, Dr. Handa, or is this something that you're seeing in COVID recovered patients?
Very good question. It can occur during infection also. Signs initially are subtle. You may just see some pale mucosa in the nose or the palate. Maybe that is the beginning. Now what we actually are seeing is patient has become RT-PCR negative, discharged from the hospital during recovery phase when things get serious. Cheek swelling, eye, vision, and they are being picked up later on. So infection is occurring during the COVID, but pickup is mostly in the recovery phase when things get serious. So we need to sensitize the public. We need to sensitize the treating doctors at the basic level that this is there.
Right.
We pick it up at the right time. Only then we can save eyes, we can save lives.
All right. Well, Dr. Chaudhary and Dr. Handa, thanks so much for sparing your valuable time and being with us on NDTV this morning. Indeed, a whole host of important issues that we've managed to cover. Thanks so much for your time.
Thank you very much.